Okay, so I'm just going to read it off from my computer. Hello, my name is Abby Haverkamp, and I'm a gynecologist based out of a local clinic in Dallas, Texas. I work primarily with young college-age women from the surrounding area, and I like to focus my work in women's health promotion and education. A health issue that I'm particularly passionate about is endometriosis. Endometriosis is an often painful disorder in which a tissue similar to the endometrium, or the uterine lining tissue, grows outside of the uterus, typically involving the ovaries, fallopian tubes, and pelvic lining. I would say around 5 to 10% of my patient population has this health issue. The main symptom is pain, so that means painful cramps, painful intercourse, and painful urination. This condition could also cause fertility issues, fatigue, nausea, bloating, diarrhea, vomiting. Treatment can range from symptomatic medications, pain medications, and hormone therapy, all the way to surgery, depending on the severity of the patient's symptoms. The duration of therapy has a high probability of being lifelong due to the recurrence of endometriomas or cysts from endometriosis. Without saying any patient identifying information, I would like to talk about a patient of mine who I've treated for endometriosis over the past year or so. She's a 25-year-old white female college student who came in around this time last year. She was concerned about how painful her menstrual cramps were and felt like it was something she should get checked out. She had already been to her primary care physician and felt like she wasn't taken seriously and was told to take over-the-counter pain medication. She decided to get a second opinion from another general physician and was told something similar. She finally made her way into my clinic, and after a thorough pelvic exam and ultrasound, I could see that she did have a few cysts on her ovaries, and was able to determine the cause was endometriosis. We started her with heavier pain medications, but quickly realized she would need the cysts surgically removed. After the removal surgery, I placed her on an Nexplanon. It's a progestin therapy contraceptive implant that goes in the arm to hopefully reduce the chance of these cysts reoccurring. And she comes in to get a regular pelvic exam and ultrasound yearly to monitor any new growths. I'm bringing up this topic because, like my patient, many young women feel that they aren't being taken seriously when it comes to their pain, especially pain involving menstrual cramps. They're constantly looked over or brushed away with orders to run a hot bath or take a Tylenol. We as healthcare providers need to be mindful of how we not only medically treat our patients, but how we treat them emotionally as well. It is our job to constantly educate ourselves about these topics because they are much more common than you may think. And it's essential for the well-being of those in our care to listen to their concerns and to take every avenue possible to reach their health goals.